Hi everyone, I welcome you all to this channel and today's video is the continuation of the previous video on solved questions of post-basic BSc Nursing 2022 conducted by Rajasthan University of Health Sciences. Question number 31. Compartment syndrome is the complication of option A fracture, option B glaucoma, option C appendicitis, option D liver cirrhosis. Correct option here is option A, that is fracture. The compartment syndrome is complication of fracture. This compartment syndrome occurs when there is excessive or increase in pressure or build up of pressure in an enclosed muscle space due to broken bone or fracture or due to cross injury, and the hallmark of compartment syndrome is of 6 P's. One is pain, 2 is poikilothermia, number 3 is pallor, number 4 is paresthesia, number 5 is pulselessness and paralysis. Question number 32. Which of the following is not an autoimmune disease? Option A, systemic lupus erythematosus. Option B, rheumatoid arthritis. Option C, myasthenia gravis. Option D, Bell palsy. The correct option here is option D, that is Bell palsy. Bell palsy is a condition that causes a temporary weakness or paralysis of the muscle of the face, and Bell palsy occurs when the 7th cranial nerve becomes swollen or compressed, resulting in the facial weakness or paralysis of the face, and the exact cause of Bell palsy is not known. Question number 33. Phacoemulsification surgery is done to treat option A, cataract, option B, otitis media, option C, glaucoma, option D, retinal detachment. Correct option here is option A, that is cataract. Phacoemulsification is the modern cataract surgery. Question number 34. Impaired physical mobility related to muscle rigidity is appropriate nursing diagnosis for option A, nephrotic syndrome, option B, Parkinson's disease, option C, peptic ulcer, option D, urinary tract infection. The correct option here is option B, that is Parkinsonism. In Parkinson's disease, there is muscle stiffness. So the person will have impaired physical mobility due to muscles rigidity. Question number 35. Pap smear test is done for option A, screening of cervical cancer, option B, screening of brain tumor, option C, screening of polycystic kidney, option D, screening of ovarian cancer. The correct option here is option A, that is screening of cervical cancer. Question number 36. Nurse should instruct the patient before an MRI. Option A, to wash hands. Option B, to remove metallic object. Option C, to wear woolen clothes. Option D, to take antihistaminic. Correct option here is option B, that is to remove the metallic objects, or if you have any metal object attached, he should remove or she should remove that metallic object before doing MRI. Question number 37. The origin of myeloma is option A, epithelial cells, option B, lymphocytes, option C, plasma cells, option D, fibrous tissues. Myeloma is a type of blood cancer that develops from cells in the bone marrow. Cells in the bone marrow called plasma cells. So the correct option here is option C, that is plasma cells. Question number 38. Which of the following patients should nurse assess first? Option A, patient receiving oxygen. Option B, post-operative patient preparing for discharge. Option C, patient scheduled for a chest X-ray. Option D, patient requiring dressing change or change of dressings. The correct option here is option A, that is patient receiving oxygen should get the first priority from the nurse who assess all these 4 patients. Question number 39. In dehydration, fluids move from option A, interstitial space to cells, option B, cells to interstitial space, option C, cells to body cavities, option D, intravascular to body cavities. Since the fluids passes from a region of lower to a region of higher osmotic pressure, so the water flows out of the cells into extracellular fluids or interstitial spaces. So the correct option here is option B, cells to interstitial space. Question number 40. What type of acid-base imbalance occur in chronic obstructive pulmonary disease or COPD? Option A, respiratory acidosis. Option B, respiratory alkalosis. Option C, metabolic acidosis. Option D, metabolic alkalosis. In COPD patient, they have a reduced ability to exhale carbon dioxide, which leads to hypercapnia. And over the time, this chronic elevation of carbon dioxide leads to acid-base disorders or imbalance disorder, and this increase carbon dioxide will lead to increase of hydrogen ions, therefore reduce the pH in the COPD patient. So therefore the patient who is COPD patient will have respiratory acidosis. The correct option here is option A, that is respiratory acidosis. Question number 41. Which of the following signs show hyperglycemia in a patient receiving total parenteral nutrition or TPN? Option A, nausea, vomiting and oliguria. Option B, sweating, chills and abdominal pain. Option C, fever, weak pulse and thirst. Option D, weakness, thirst and increased urine output. In hyperglycemia, the patient may experience weakness, thirst, and also he will have increased urine output or polyuria. The correct option here is option D, that is weakness, thirst, and increased urine output. Question number 42. Increased BP, bounding pulse, jugular vein distension, and crackles bilaterally indicates which complication in patient receiving total parenteral nutrition or TPN? Option A, hyperglycemia. Option B, air embolism. Option C, sepsis. Option D, fluids overload. The correct option here is option D, that is fluids overload. Fluids overload can cause increase in BP or pounding pulse, or can distend the jugular vein, external jugular veins, and also may cause pulmonary edema, or when ausculting we can also hear crackle sounds. Question number 43. Which of the following complication arises if IV site is cold, pale, and swollen, and the solution is not infusing? Option A, thrombosis. Option B, infection. Option C, infiltration. Option D, phlebitis. The correct option here is option C, that is infiltration. Question number 44. 1000 ml of normal saline to be infused over 12 hours. The flow rate should be, here the question asks to calculate the drops per minute, and the drop factor is given here, 15 drops per ml. Option A, 15 drops per minute. Option B, 17 drops per minute. Option C, 21 drops per minute. Option D, 23 drops per minute. Here we have the formula to calculate the drops per minute. Drops per minute equal to the fluid's volume to be infused in ml multiplied by in ml multiplied by drop factor divided by time in minute. And I have made video on drug and fluids calculation. You can click the I button at the right top corner of the screen to watch the video after watching this whole video. So the drop per minute is equal to the fluid volume is given 1000 and the drop factor is given 15 and the time is 12 hours. So we have to convert into minute. We'll multiply it by 60. So 0 will cancel. 100 multiplied by 15 we will get 1500 and 12 multiplied by 6 we will get 72. 1500 divided by 72 will get 20.83, which is equal to 21 drops per minute. So the correct answer here, or the correct option here, is option C, 21 drops per minute. Question number 45. Most appropriate location to assess the pulse of an infant during basic life support is option A, brachial, option B, carotid, option C, popliteal, option D, radial. The correct option here is option A, that is brachial is the most appropriate location or site to assess the pulse of an infant. Question number 46. Which of the following medicine must be stopped 48 hours before surgery? Option A, aspirin, option B, ibuprofen, option C, morphine, option D, gentamicin. The correct option here, option A, that is aspirin. Aspirin must be stopped before surgery due to risk of perioperative bleeding. Question number 47. Which position is most suitable for NG tube insertion or nasogastric tube insertion? Option A, high Fowler, option B, supine with flat head, option C, right side, option D, low Fowler position. The correct option here, option A, that is high Fowler position. Question number 48. The definitive diagnostic test for herpes zoster is option A, skin biopsy, option B, Wood's light examination, option C, culture of deletion, option D, patch test. The correct option here, option C, culture of deletion. And Wood's light examination, or also called Wood's lamp, was developed by American physicist Robert Wood, and this wood lamp is used as a source of long wave ultraviolet light and can be used to detect the fluorescence in skin and in the hairs. And patch tests are the tools used to identify the etiology or the agent of allergic contact dermatitis. Question number 49. Which of the following precautions should institute during the assessment of patient with scabies? Option A, wear a mask and gloves. Option B, wear gloves only. Option C, wear gown and gloves. Option D, no need to take protection. The correct option here, option C, wear a gown and gloves. Question number 50. Which of the following topical medicine is used to treat herpes simplex? Option A, triple antibiotics. Option B, acyclovir. Option C, mupirocin. Option D, mesoprostol. The correct option here, option B, acyclovir. Acyclovir is the antiviral medicine. Question number 51. The breast self-examination should perform. Option A, at the onset of menstruation. Option B, 1 week after menstruation. Option C, every month during ovulation. Option D, weekly at the same time of the day. The correct option here is option B, that is 1 week after menstruation. Question number 52. Most common symptoms of bladder cancer is option A, frequency of urination. Option B, urgency of urination. Option C, hematuria. Option D, dysuria. The correct option here is option C, that is hematuria is the most common symptoms of bladder cancer. Question number 53. Which of the following solution should you use for irrigation of the colostomy? Option A, distilled water. Option B, saline solution. Option C, sterile water. Option D, lactated wrinkle or wrinkle lactate. The correct option here is option B, that is saline solution or normal saline. Or normal saline is the solution you should use for irrigation of colostomy. Question number 54. Typical symptoms of duodenal ulcer is option A, nausea and vomiting, option B, pain that is relieved by food intake, option C, pain that radiates down the right arm, option D, weight loss. The correct option here, option B, that is the pain that is relieved by food intake. Duodenal ulcer tends to cause abdominal pain that comes several hours after eating, and this is due to presence of acid in the stomach without food. So if the person who have duodenal ulcer, after taking food or taking antacids, and this pain get relieved. So the correct option here is option B. Question number 55. Most common risk factors for recurrence of pancreatitis is option A, diabetes mellitus, option B, alcohol intake, option C, duodenal ulcer, option D, Crohn's disease. The correct option here is option B, that is alcohol intake will increase the risk for the recurrence of pancreatitis. Question number 56. Anginal pain that is prolonged, severe and occurs at the same time each day without precipitating factors is described as option A, stable angina, option B, unstable angina, option C, variant angina, option D, non-anginal pain. The correct option here is option C, that is variant angina. Stable angina occurs, the occurrence of symptom is due to exertion, and it is predictable and lasts for short time. And unstable angina, the occurring of symptoms is address, and it's unpredictable. And non-anginal pain, or also called as non-cardiac pain. Which of the following intervention should be avoided after renal biopsy? Option A, encouraging fluid intake. Option B, administer narcotics for pain relief. Option C, testing cereal samples with dipsticks for alcohol blood. Option D, ambulating the patient for short distance. The correct option here, option D, ambulating the patient for short distance should be avoided after renal biopsy. Question number 58. Priority nursing action before intravenous pyelogram would be option A, administer radio-opaque dye orally. Option B, restrict fluids. Option C, determine a history of allergies. Option D, administer a sedative. What is intravenous pyelogram? Pyelogram is the imaging test for renal pelvis and ureter, and it includes the use of this contrast solution through the veins into the circulatory system. So the nurse, or the priority of nursing before administration of this IV contrast is to determine the history of allergy. So the correct option here is option C. Question number 59. Which of the following action is necessary to prevent major complication of peritoneal dialysis? Option A, monitor patient's level of consciousness. Option B, maintain strict aseptic technique. Option C, add heparin to the solution. Option D, change the dressing daily. The correct option here is option B, that is maintain strict aseptic technique. Strict aseptic technique should be maintained to prevent the complication like peritonitis, which is a severe complication or the major complication of peritoneal dialysis. Question number 60. Which of the following person is at greatest risk of developing osteoporosis? Option A, 40 years old man with asthma. Option B, 25 years old woman who jogs. Option C, a sedentary 65 years old woman who smokes. And option D, a 70 years old man who consumes excess alcohol. The osteoporosis osteoporosis affects both men and women. Both women who or older women who already attained menopause are of greatest or highest risk for osteoporosis. A woman who already attained menopause is or are at the highest risk of getting osteoporosis. So the correct option here is option C, which is a sedentary 65 years old woman who smokes.